We'll start our third part of childhood disorders, and this part will be on Down syndrome. Down syndrome, it is the most frequently occurring chromosomal condition, 1 in every 691 babies. It typically occurs when, at the time of conception, an extra copy of chromosome 21 or part of its long arm is present in the egg, or less frequently in the sperm. Down syndrome is highly related to the age of the mother. The risk is markedly increased with the age of the mother. At age 25, the risk is about 1 in 1,250 births. At age 40, it is 1 in 100. 85% of children with Down syndrome are born to mother less than 35 years of age because of the high fertility rates in young women. Down syndrome has got very specific physical and developmental characteristics. There are something like 50 characteristics. These manifestations are present in variable degrees. Some of these characteristics include mild to moderate intellectual disabilities, low muscle tone, upward slanting to the eyes, flattened facial profile, an enlarged tongue, and increased risk of congenital heart diseases, respiratory problems, and digestive tract obstruction. What about the course of children with Down syndrome? Babies with Down syndrome develop much as typical children do, however, at a slower rate. They, just as their peers do, they learn to sit, walk, talk, and toilet train. Early intervention programs can begin shortly after birth and can help foster an infant development. By the age of 40, nearly all people with Down syndrome show some neurological changes similar to those seen in Alzheimer's disease, and most of them show cognitive decline by the age of 60. The management. Early intervention programs can begin shortly after birth and can help foster an infant's development. People with Down syndrome have been able to have longer and fuller life. They are being educated in their neighborhood schools, participating in community activities, and they have very rewarding employment and relationships. The prenatal diagnosis. Down syndrome could be diagnosed during pregnancy. There are prenatal screening tests, such as the triple and quadruple screening, maternal blood, and urine tests. Also, they can accurately detect Down syndrome in about 70% fetuses. The definitive prenatal diagnosis can be obtained either with chorionic villus sampling or amniocentesis and chromosomal typing of their cells. The future. Now there are several mouse models of Down syndrome that will allow scientists to focus on molecular factors which are important in this condition. Once this mystery is understood, researchers hope to decode the biochemical processes that occur in Down syndrome, and they will learn how to treat or cure this disorder. And this finishes our third part.